Hello and welcome to EchoMap, the practical, easy, and above all, useful ultrasound resource for general practitioners. So today, this video is aimed at beginners in ultrasound, especially musculoskeletal ultrasound, because we're going to talk about a particular setting, which is the focus. These are questions I get asked regularly, either directly on the channel or through the website, echomap.fr. So I was asked to clarify a little bit. And so I thought I'd make a new video to include it properly in the beginner's training. So if you like this channel, go ahead and give me a like. And of course, subscribe to the channel. Your comments always make me really happy. Honestly, that really motivates me to keep going because I can see that all this work I do on top of my consultations is actually useful to you and you have questions. You can really see that this isn't work done for nothing and that it helps you make progress. And at the same time, it's kind of an exchange, because it also helps me improve by adding little details that maybe I forgot to mention in the course. So there you go. Now that's taken care of. You asked me to clarify a bit, especially about focus and how to manage with musculoskeletal images that are sometimes hard to analyze. Well, that's exactly what this video is about. Also, subscribe to the Facebook page, give me a like, leave a comment. This way you'll be notified right away when new videos come out. And the introductory training I mentioned is still available at the time I'm making this video. The link is in the description. Just click on it to join me and take part in this great training where we talk about, well, exactly the settings, the pitfalls in ultrasound, what you can do, what you can't do, and so on. Well, I really encourage you to take it in any case because it's a very, very good starting point for getting into ultrasound and doing it under the right conditions. And it's also a way to discover things that aren't always explained elsewhere, because people might tell you, well, this is what a tendon looks like, but what about the settings? And how do you actually use the machine? And how does it work? Well, that's exactly what this training is about. So the clinical case for today is about a 64-year-old female patient who came to see me for a recurrence on her toe, her big toe, of a swelling, a bump. Visually, it clearly looks like a collection, except that she had surgery on her big toe 3 months ago, where they removed her nail because of a deep abscess that was in contact with the bone. The aftermath had been pretty straightforward. The healing was a bit complicated, but all in all, it went okay. And now, 3 months later, she comes back to see us saying, well, look, I have this coming out on my nail again. Can you take a look with the device? So these are the images we obtained. And today's topic isn't so much about the diagnosis, but really about analyzing the image and understanding what we're seeing. So here you can see we have the last phalanx of our patient, right? And here we have the skin tissue, and there's a bit of gel that's going to be placed between the two. And then we can actually see a collection here, very anechoic. It's a bit hard to really define the image. It looks like there might be something else a little deeper. This image is a bit tricky to analyze because overall the image is still kind of blurry. It's not well defined. It's a bit messy. And why do we have an image like this that's not well defined? Well, that's going to be explained by how ultrasound works and by the settings. You can see here that our focus zone, the focus zone, is set to the maximum. We can't make it any smaller on this device, you know? That's the case for most devices, if not all of them. And the problem is that our image is actually a little too close to the surface compared to the focus. They say that to get a quality image, it's better to have the focus a little above rather than a little below the area you're studying, because above, it's like a camera. Actually, if it's above, your device won't be able to bring the image in a sharp focus, and that'll end up interfering with the interpretation of the ultrasound image by the device. If we make a second scan just a little bit, here's what we get. You see, still the cutaneous tissue. Here we have the cortical bone part. Between the two here, I'm trying to expose a little more, you see? You can actually make out a slightly deeper collection, maybe even a connection, but as you can see, it's very dark, right? It's very dark. It's hypoechoic. Here, it's the same. The collection is hard to define. This one's a little easier since it's located below the focus. In any case, anything above the focus is problematic when it comes to interpreting the image. In dynamic mode, here's what it looks like, and you'll really understand in motion, well, the difficulty, you see? You can see that here we have an image that's particularly messy, very hard to analyze. We can't really see the communication, and it's hard to get a good view. Actually, you can see I move my probe quite a lot. It's hard to define the collection. Is it anechoic? Is there a foreign body? What is inside it? You can see that overall it's still pretty difficult. So how do you manage when you can't bring the focus closer to the image, But on the other hand, the image is blurry. How do you deal with it? Well, you just need to use a lot of gel. You'll see that by putting a lot of gel between your probe and the subject, basically creating a layer of gel, which I'll call the gel pad in this video, it'll help you in several ways. First, it'll move the image further away from the probe, so your focus will be better positioned. You'll also have more flexibility in managing your focus. As you can see here, I've ended up putting a thick layer of gel between the surface of my probe and the patient's toe. And with this layer of gel, of course, you shouldn't press down too hard. You just need to lightly touch the patient's skin, otherwise you'll push the gel away. Well, this layer of gel will allow us to adjust the position of our focus here with the image we're studying. And what we immediately notice is that this image, which was completely anechoic when it was close to the probe, is actually hypoechoic and slightly heterogeneous. In the end, this matches much more closely with the appearance, well, the typical appearance of an abscess. Similarly, our skin surface is more visible, the image has become sharper, and even the cortical bone, which has moved just a little farther from the probe's surface, is now more visible. We still have a few minor imperfections here in the image. Here you can even make out, perhaps, a small secondary collection. So, now we can look a little more closely at the image. We're going to add a bit more gel and adjust the angle slightly. And now, surprise, by improving the image quality and lowering the focus a bit, you can see that this time I've set my focus at 1 centimeter depth. Well, in fact, there is a second collection that communicates directly with the first. A second collection at the level of the cortical bone. And here we could also wonder if there might be a third collection area, really in direct contact with the cortex. You can see that simply understanding this concept of focus and realizing that if the image is ultimately too close to the probe, you'll end up with a blurry image that's hard to interpret, which can lead you to make errors in ultrasound interpretation and diagnostic mistakes. Well, by simply creating this gel pad, this layer of gel, you'll be able to correct your diagnosis. Look here as well at the hypoechoic area at the nail bed. This woman no longer has a nail. It was removed. At the level of the nail bed, we can also see something hypoechoic here. This small superficial collection that in the first video, or rather in the first image, we might have wanted to simply incise with a quick swipe of the scalpel, actually turns out to be much more complex, deeper, and goes directly down to the bone. We're really getting much closer to a situation that will require surgical management here. Except if you don't know about the focus principle, the gel pad principle, you might think, well, sure, there's a small superficial anechoic collection. I'll just make a quick incision with the scalpel and the problem will be solved. So you can see that properly adjusting your image is absolutely crucial for the accuracy of your diagnosis and for managing your patient. In real time, in video, this is what it looks like. You can clearly see the thickness of the gel. You can see that I'm pressing very, very lightly on the probe. I'm just barely touching the patient. Otherwise, the image immediately gets closer, you see? If you let up a little, otherwise the image immediately moves closer to the probe. And you can see that the image we obtained this time is quite different from the one we get without the gel pad, simply because the focus is much more precisely set on what we're trying to see. Focus is something very important in ultrasound. You can clearly see here the second collection and the connection. We're still a bit bothered by this artifact, you see? This scattering of the ultrasound waves here. Is what? Well, it's because of this sharply angled wall here, which will deflect the ultrasound waves and create what's called a technical shadow cone. We talked about this in the introductory training. Well, once again, the gel pad will allow you to change the angle, making it very easy to adjust the angle of your probe. You can see here that by changing the angle, we can analyze the deep collection that's in contact with the bone more precisely. And we might wonder if there could be a foreign body, possibly a resorbable suture or a nail fragment, from when it was removed, that could still be there and be causing this recurring collection. Now, let's angle the probe the other way. You see, I'm pressing down on the gel a bit here, but I'm using more gel on this side. Well, you can see that we're highlighting the collection a bit more, the connection between the superficial collection and the deep collection, just by angling our probe. This is what it looks like in real time. Thanks to the gel pad, you'll be able to explore your lesion from different angles, since you're not introducing any air. There's no air getting between your probe and the structure you're examining since you have plenty of gel. And you can see here, we can really clearly identify this connection and the deep collection. So being able to access different angles is very important too. And that's only possible if you use enough gel and don't press too hard with your ultrasound probe. So you can see that this little thing about the gel pad, which might seem a bit trivial to beginners, actually turns out to be absolutely crucial for making diagnoses without risk of error and being much more precise in your diagnostic approach, especially in musculoskeletal cases. So I hope this training, aimed at beginners, might also serve as a little reminder for those of you who are more advanced in ultrasound. I hope you enjoyed it. If you did, feel free to give it a like and subscribe to the channel. Same goes for Facebook. And the introductory ultrasound training is available for free. So if all these things about depth, image management, and focus control feel a bit distant to you, and you want to improve and create better images, and here we clearly saw that the settings really have a huge impact on your image quality, right? These two are done with the same machine, the same probe, the same patient. So if you want to learn more, take the training and click right now on the link in the description. All right, see you soon on Eclomac. Bye-bye.